Welcome back. Now for our final session of the day, we have an interview with Chinta Bhagat. I'd like to remind you there are two excellent problem-solving workshops tomorrow on two key topics: delivering digital excellence and getting the workforce monkey off your back. Please register for these via the app. So, over to Max and Chinta.
This conference has been all about the impact of digital health on healthcare services. This is really the subject which the chief executives you've heard from over the last 3 days have really been focusing on more than anything else. With COVID, it really has become top of everyone's mind. I wanted to bring in Chinta Bhagat from El Caterton today because Chinta really has, in a way, a incredibly deep knowledge of this area. He has spent 14 years, first of all, at McKinsey, doing a lot of work in healthcare services and ending up running the Singapore office before he joined Kasana Nasional, where he was intimately involved in the rollouts and acquisition strategies followed by IHH, the Pan-Asian Hospital Group. So he has an extraordinarily detailed and in-depth knowledge of how healthcare services actually works. Yet over the last 18 months, since he joined El Caterton, he has really been focusing on digital health and looking at digital health as an investor alongside how this is going to affect healthcare services in general. So he really has this unique view. So Chinta, I think why don't we start with how you see healthcare services and the impact of digital health? I know you've got a couple of slides, so shall we have a look at them, please? Over to you.
Sure. So Max, let me start by saying firstly, hello, thank you for having me. And I wish we could have done this in person. Just before I get to the slides, every year I've been coming to your conference for the last few years. And together with a few of my buddies from around the world, we'd have a conversation about the theme of the year, right? I remember 3 years ago, we talked a lot about oncology. A couple of years ago, it was a lot about genomics. And this year, coming out of JP Morgan, I had been looking forward to coming to London and seeing all of you again in person. And even before COVID, health tech was already on our minds, myself and together with a bunch of my investing colleagues. And lo and behold, we then had COVID, and of course, health tech is now on everyone's minds, but it already was on our minds. But before we get into digital health per se, let me just give you a bit of a framing of how I think about this topic, right? I use a couple of slides to do that. Can you put up the first slide, please? So, healthcare really for me is a spectrum, and particularly from my new vantage point where I work for and run the Asian operations of the world's largest consumer investor. The consumer really is one end of the spectrum, the way I've depicted it. And on the other end of the spectrum is the doctor, the hospital, the clinical end of the spectrum. Right? And it is of some amusement to my colleagues on the consumer side. They describe healthcare as probably the only B2C industry in the world which treats its customers so badly, where you can basically interact with a health system. And I quote, by the way, I won't name the individual, who says you enter a hospital, you have no idea how much you're going to pay. You have some idea that you're going to get better, but you're not really sure. You're probably going to have a terrible service experience, and yet you can't wait to get in. You're like knocking on the door. Right? There's almost no B2C industry that treats customers this badly and gets away with it. Right? That's the vantage point that I'm in right now. That's what my colleagues say. Right? So that's kind of the spectrum. But along that spectrum, there is a line somewhere in the middle. Next slide, please. And that line is what I call the gray zone, where on one side of the line, which is where most healthcare practitioners and healthcare investors sit, the right side of this page, it's really about curing the sick, which is why it's called healthcare, right? As opposed to not getting sick in the first place. And the other side of that line is it's what I call upgrading the healthy or keeping people well. Right? And that gray zone really is defined by regulation for the most part. Bunch of other stuff, the ability to build a brand, etc., but by regulation. And most businesses, the way we investors look at them, the stuff that's on the right side of the line is blocked by regulation. The stuff that's on the left side of the line is where you don't need a regulator getting involved. Next slide, please. So let's talk about digital health, right? So even before we talk about digital, let's just talk a little bit about the 2 or 3 technological forces that are underway here. So the top of the page is the product side, the bottom of the page is the services side. So if you think products, and I know we're not going to talk much about products today, but products are really what are moving from what are called mass manufacturing, where you come up with a stent design, or you come up with a pharmaceutical product, and then you mass manufacture it in a factory, and then you pump it through distribution channel around the world. Right? That's been the world of products. But that's shifting towards mass personalization, where at some point of time in the future, I don't know whether it's 10 years, 20 years, 30 years out, where you will literally come down to having a product bespoke designed for a single customer. We are very far from that world yet, but it's getting there very quickly. And it's mostly driven by genomics, by our ability to understand the unique human body and to be able to tailor every product and every medical product and pharmaceutical product around it. Let's put that aside. Today is not about genomics. The second, equally important one is what pivots around diagnosis. Because at the end of the day, your first point of contact with any kind of healthcare system is to figure out what's happening to you, whether something's going to happen to you, and what that is, right? And that's been mostly what I would call experience based, where you talk to a senior physician for the most part, or you consult a specialist group. And what you're given is what I call an experience based diagnosis, saying, don't worry, we've seen this before. We know what's happening to you. We're looking at your test results. We've seen 10,000 of these kinds of patients, and it's most likely A, B, or C. And today you're moving to much more data-driven diagnosis, where whether it's something simple, where Cure.ai will read a chest X-ray or a head CT scan, and to be able to spout out a better answer than the physician who's talking to you will. And this is again an inexorable trend. And then let's talk about digital health, which is particularly on the services side, the last one, which I think is moving from hospital-based to home-based. And these are just glib words, right? So what does hospital-based to home-based actually mean? So Max, I think I've probably said this to you before in previous conferences. The general hospital as the be-all and end-all of specialized care hasn't changed very much for a few hundred years. I haven't done the research. I don't know whether it's been a 500 or 200, but I know it's in centuries. And where the model of care was really going to a sterile facility, a large monolithic sterile facility, and you walk in there with any kind of complication, and you're supposed to get better. And obviously that model has probably outlived its usefulness, but it's like democracy, right? Until something better comes along, that's what we're all stuck with. And so what is that better that's coming along, and where is digital health actually making a difference? Which is sliver by sliver, condition by condition. Patients are getting now treated like customers by attacker brands and attacker companies that are telling us, open your phone, open this app, feed in your data, take a photograph of the wound on your arm or whatever. We'll tell you what's going on, and we'll tell you precisely what you need to do. And by the way, we'll minimize your contact with this big monolithic thing called the hospital, because we know it's frightening, we know it's expensive, and we know, what, it's probably not going to make you better. And so that's really what I call the digitalization of healthcare. And this has been an inexorable trend that's been around for a while. COVID has only accelerated it. So in fact, much of what we're going to talk about today and the companies that are doing well, these businesses existed for the last 5 or 10 years. I think what's happened with COVID is people have woken up to it, because now for the first time you have a push factor called a pandemic that's actually keeping you locked up at home, and you certainly want to be as far away from a hospital as possible. That's kind of my framing, right? So let's use that as a way to take it forward.
Okay, fine. So really you see digital health as something which basically is going to unpackage that hospital and move it into the home in quite a radical way. So you're really, in a way, forecasting the death of the general hospital, or its demise.
Look, I've been forecasting its demise for a while, and I think anyone who is experienced a hospital as a patient probably doesn't want something better anyway. I spent a lot of my time studying and investing in hospitals, and I'm still, in a sense, vested in their success. But I don't think they're going to disappear anytime overnight. This is a multi-decade phenomenon. I do think the coming decade is going to be pretty critical, where stuff is going to pivot.
So you'll end up with companies which are oncology specialists or specialists at treating diabetes. I mean, some people, of course, will have a wide range of different conditions, won't they? So in those circumstances, isn't a hospital going to be the natural place to go?
Certainly. So, if you would just roll all of this out and imagine a world which has, let's just say, I'm making this up, there's typically something like 30 to 40 subspecializations in a large academic medical center, give or take. There's 10 big
Yes.
specialties. There's somewhere between 30 and 40 by the time you get to serious subspecialization. And let's imagine for a moment that over a decade or two, every one of these 30 has a winner and a bunch of others, right? And so those pathways have played out. That doesn't mean there isn't a place for the seriously sick uh, patient with lots of comorbidity and lots going on in the body who are going to land up in a facility where all of this can come together. So, which is what I'm saying. I don't think the hospital is going to disappear in its entirety. I still think that a lot of this can get and will get over time delivered at home. I think the two interventions that a hospital takes care of that are very hard to deliver in a home. One is a sterile facility, so something where you need to actually perform an intervention. I can't see a home-based operating room anytime soon. And the other thing I think that's going to be very difficult is convalescence, right? So if you want an ICU level facility at home, there are companies that are doing this. Healthcare at home in the UK, there's one in India as well. But I think that's not going to happen anytime soon. So, but I do think that there will be a place for a general hospital for quite a while. What we can debate country by country, system by system, is how big and how much.
Right. Okay. Fine. Well, let's come back to that interesting point. So, you also looked at sort of scoping the kind of size and of these different sectors and what they look like. I know you've got a slide on that. Shall we have a quick look at that?
Sure. Now this, next page, please. Now, I'll preface this by saying this data is put together by our teams and it uses various data sets. So, I won't vouch for perfect accuracy, but I will tell you it's directionally right? Which is, and why this is interesting is this is much more here and now. I'm looking at this as an investor and saying, if I want to put capital behind digital health, what are the biggest addressable markets where we want to put capital and what's actually going on? So in a sense, this cut on this page represents my areas of interest more than necessarily a comprehensive view of digital health. And so surprise, surprise, the three that stand out are ones that are at the customer end of the spectrum, this previous spectrum that I showed you, much less on the hospital end of the spectrum. And so what are the most obvious areas? The first is pharmacy. Now, pharmacies, this is an e-commerce business, right? This is not even strictly digital health. It's almost a surprise to me. I'm sure there's some very specific country and market specific reasons. It's almost a surprise to me that it took a full 2 decades for Amazon to start taking pharmacy delivery seriously in the US. I mean, they only bought PillPack, I think, a couple of years ago, roughly a couple of years ago. And it's after they've gone through pretty much every other major vertical that they've taken on the CVS Caremarks of the world in the US and are now taking pharmacy delivery seriously. This particular category has been, I wouldn't call it disrupted, but certainly attacked by e-pharmacy specialists in places like India, China, and probably in parts of Europe much earlier. It is quite easy because at the end of the day, this is simply a retail distribution business. But because there is a patient or a customer relationship there involved, which mostly is associated with either chain pharmacies, the likes of Watson and others in various parts of the world, or in more fragmented geographies like in developing markets where I currently reside. It's very much with your kind of pharmacist around the corner who does a little bit of diagnosis before they kind of dispense a medication, the over-the-counter stuff. But this is always ripe for e-commerce disruption. And no, it's no surprises that this is the part that's growing probably among the fastest. So over the next 5 years, we expect this to become like $100 billion market. It is yet, by the way, this game is much less about healthcare and much more about retail and distribution and e-commerce. So we don't, even I don't particularly as a complex healthcare business. The second is telehealth and remote monitoring, and I bucket the two together for a reason, right? Because these are, in a sense, two sides of the same coin. And this is what probably the area that's growing the fastest during COVID. So if you look at Insight 2020, both telehealth and remote monitoring have jumped. Telehealth for the obvious reasons, because you don't want to get to a physical place. You want to get a teleconsult done for the first time on the phone or in the device. But at the same time, that's not enough, because you do want to be monitored, and monitoring technologies have gone up, both economically, but technologically they've improved dramatically. So whether it's simple monitoring, like simply kind of tracking what's going on your inside your body, that's being picked up by either the phone or the watch, the Apple Watch or the Fitbit or whatever, or it's more complex stuff like glucose monitoring, the likes of Dexcom, the Panasonic healthcare people who are monitoring what's going on inside the body, whether it's glucose monitoring, it's cardiac rhythm, it's thyroid monitoring, so some kind of hormonal order or disorder monitoring. All of this, we believe, is a big market. And it's not, this is not about care as such. It's simply about figuring out what's going on. It's diagnosis, continuous diagnosis. Again, a very large market. And the third area is what I loosely call disease management. And honestly, Max, disease management is more of a catch-all for all of the various specialties we were talking about earlier, and the digitization of these specialties. I think where that's already a well-known phenomenon is in diabetes. I think that's been the one area which took off quite a while ago, and you had the likes of Livongo and Omada in the US. And there are several such cases around the world, because it's probably the most obvious case where horrible things happen if you don't monitor it and manage it much more aggressively. But this is already well known. It's already become a trend in mental health, Alzheimer's, dementia monitoring, other forms of mental health. And over time, I'm now seeing more and more businesses that I wouldn't have imagined them as being clinical pathways, but becoming clinical pathways. So I've seen musculoskeletal businesses in 2020, where people are now again being attracted to an app, and where the app will monitor your gait, the way in which you walk, the way in which you sit, and to be able to advise you to try to make sure that all of that is being taken care of, to try and prevent a hip replacement or a knee replacement or a spine surgery, for example. So that's all in the disease. These three are what I would call the largest trends. And there are $100 billion.
When you talk about consumer health tech markets, what do you actually mean by that? Because I mean, is this saying that the consumer is the purchaser, or how do you define what's consumer and what's B2B? It sounds a silly question, but I'm confused.
It's not a silly question at all, Max. It's an important question. Healthcare is complicated by that, right? It is one of the B2C businesses which isn't actually designed around the C.
Yeah.
Because most health systems emerged not, yes, they're at the end of the day care of patients. We all know that. That's just the line. But if you look at system design has almost never been done patient back or customer back. It's been done with either top-down governmental infrastructure policy plans being implemented, or it's been done around money flow, which is really where do payments come from. But I think it's becoming much more of a consumer industry in a sense, where age-old business models are essentially being put aside by a lot of the new businesses that we're seeing, and they're all starting with the customer first. There is the added complexity. So when I say customer, it's consumer health tech. What I mean by consumer health tech is it's new businesses designed first and foremost for the consumer, and where the consumer's making the choice of which provider to use, whether it's to get a pharmaceutical product delivered, whether it's to monitor health or to treat a disease. The customer's making the choice, and the customer's largely deciding how to pay for it, right?
So the consumer is the driver of demand. The consumer in these cases is to some extent in the driving seat, even if the insurer says you've got to use this app. That would still be a consumer market, because the consumer could say, I'm not going to do that. Is that what you mean?
Correct. Absolutely. Now, again, there's some tension there, because I haven't spoken to Sean Duffy in a while, and I don't know what it took for Omada and Livongo to actually get on the formulary of so many of these insurance companies. But I have to believe that it would have been reams and reams of customer data saying, we want this stuff, we value this stuff, We'd like you to be able to pay for this stuff.
Yes, I mean, one of the things which you hear over and over again over COVID has been people telling me that once somebody has had experience of telehealth and the ability of having a remote session with a doctor, they're won over. 80%, 90% of the people who Aetna are dealing with, or United Family Health in China are dealing with, the constant thing you hear is they want this stuff. Once they've had it once, they want it again. I guess.
Well, in a way, Max, the pandemic has had, lots of horrible things have happened, right, because of the pandemic. But had the same pandemic arrived a decade ago, which is nothing, right? If you think about the Spanish flu being the last major pandemic in the world, over 100-year period, this virus could have erupted in 1970, 1990, or 2030. It just so happened that it came about in 2020, late 2019, early 2020. And it just so happened that right now, technology that allows us to interface like this, you and I are speaking on an electronic link, is good enough to be able to hit that bar, to be able to deliver a good enough consult to be able to make that customer feel comfortable, the patient feel comfortable. 10 years ago, I don't think it would have had as big an impact on digital health. Maybe 10 years from now, this would have been a commonplace phenomenon as well. So I think in a way, digital health has gotten lucky.
Yes.
With timing.
So what things haven't worked in digital health? I mean, if we look back over the previous decade, there has been a lot of talk about it, and a lot of that talk didn't actually lead to very much, did it? If you look at, so why has it been so slow to take off, if you like?
So I think one of the things is just to do with healthcare. Right? I mean, healthcare is at once an industry, a social good, and a pretty complex ecosystem. So I think I think it's the Economist. Digital health was on everyone's mind. So there's an Economist article out this week, which I was glancing through, which talked about how banking and healthcare were 2 decades ago were the last 2 industries left to not embrace digital technology. And then 2 decades later, healthcare is the only one that's left. Even banking has caved. But so I think healthcare just is, in general, moves a little slow. And you know what? I don't mind it, because for all of the inefficiency, when something goes wrong in digital banking, somebody loses a few bucks, maybe they get a bad customer experience. Things going wrong in healthcare, bad things happen. So I'm a little bit conservative when it comes to all of this disruption. I'm actually okay with a slower pace of change. But on the flip side, I would argue that this is how most innovation happens. For the first 10 years, people talk about it a lot and nothing's working. So there's some degree of frustration saying, you know what, nothing's changing. People are just talking about it. Yes. And then someday it starts to work. And at that point, you don't get the sticker shock of like an aha moment, because the only thing you're saying, well, it wasn't working all this time. Now it's working. What's the big deal? Right?
Yeah. So you suddenly see.
You
suddenly see consumer behavior change, don't you? I remember in the computer industry, it was when people said, well, people will start downloading software off the internet. And I thought, well, what about the manuals? What about the support? People aren't going to want to buy software without manuals. Do you remember the manuals? So, you had this question as, and within 2 or 3 years, it was quite clear which way it was going. But I suppose the difference is that this is a unionized profession in a way that, and regulated profession in the way that as industry, in a way that, of course, IT isn't. So let's go on then. I mean, you've got another slide, haven't you, on where you're seeing on examples of contenders by areas, I think, haven't you?
Yeah, I do. We can flash up the page, and I can also tell you where I'm spending most of my time, because there's a lot on that page. Can you pull up the next page as well?
Let's have a look. I'm going to put my glasses on. Oh, guys, incidentally, you've got this complete slide pack and a few extra slides within Swapcard. So if you're watching this, you can download it. You can look at this at leisure or alongside this. So don't worry if you can't read everything, because you've got it. You've got to download. Thank you. Okay.
So, I've forgotten my McKinsey discipline. So this slide is not what I would consider MECE, which only an ex-consultant will recognize what that word means. Mutually exclusive and collectively exhaustive. So it's not a perfect framing, but it's more of a mental model of how to think about what's going on in healthcare relative to that spectrum that I talked about, right? So if I just run my way from the top to the bottom and areas of interest, I continue to be fascinated by genomics. It has less to do with digital health, but I think that's going to change everything. And shame on me that I haven't actually put enough capital behind genomics businesses, but I continue to talk to all of these people who, for the most part, have been focused on building databases, improving genomics technology, obviously, and continue to bring down the cost of sequencing, but to be able to build up databases for ultimately targeted clinical treatments. And they're all ultimately going to go into the drug discovery channel, which is what's happened with the likes of the folks in the US, including people like Flatiron Health and Foundation Medicine, but also some of the other specialist genomics players. What's more interesting for us, which is some of the middle blocks, right? So, stock disease management. It's probably the area that I'm most interested in, and although it doesn't occupy much real estate on this page, I could put a 30-page deck together behind disease management, where we're looking at the diseases that have already been quote unquote cracked. They're not been fully cracked, but the clinical pathway and the digitization of that clinical pathway to be able to either prevent bad outcomes or to be able to address them when they arrive have been figured out. Right? And diabetes is the best example of that. But there's a whole bunch of others. We've come across a business in China more recently, which is all about monitoring fertility uh, productivity cycles. And again, there's a specialized app for it. There's a specialized thermometer for it. There's a specialized set of tests which can all be conducted by the customer directly and uploaded in the app, all as a way of monitoring fertility cycles in a way where we can improve fertility outcomes. Very new business, relatively new space. There's probably less than 10 players in the world doing stuff like this. And no surprises, the companies are themselves quite small. I think the best player in that category is in Sweden. There's one in the US, there's one in Sweden, there's a couple in China. There's always a couple of these in China. China is doing particularly well in digital health, Again, an interesting area. Under disease management, again, another area that I'm particularly keen on is musculoskeletal and mobility. I think as people age, staying mobile and staying mobile with dignity is going to become more and more important. And so this isn't going to be as simple as an intervention-based pathway anymore, where you kind of wait till the age of somewhere between 50 and 60, and you have your first ligament tear and you get one intervention or a staple, and then at some point between that and an old age, you land up with either a knee or a hip replaced. That's kind of the old world. It's a very profitable world, by the way, for general hospitals and for specialist providers like hospitals for special surgery. But I've seen clinical specialists in orthopedics thinking about prevention for the first time, right? I mean, with all respect to my orthopod friends, they're much more interventionist, like the cardiologists are relative to the rest of the gang. When the orthopedists start talking about prevention of hip replacements, something's changed. Right? In clinical mindset. And they're now talking about building apps that are able to, as I talked about, monitoring gait, monitoring posture, monitoring, supplying products so that, designing specific kinds of footwear, designing belts to be able to prevent orthopedic incidents. And then over time to be able to make those incidents fewer and less painful experiences. Again, there are businesses getting built there that are again quite interesting. And it's a big spend area. Right? So again, as an investor, I'm quite interested because if you look at orthopedics as a specialty, it's pretty big. Right? And then I'll touch on a couple of other areas and move further down the page. Cardiology has obviously always been a big one. And cardiology also lends itself to easier remote monitoring because, besides the heart rhythm, which you can pick up off your wrist, there's also quite a lot of device innovation now on stuff that you can do outside the body. So you don't actually have to have a pacemaker before you're monitoring. You're dependent on an external device for cardiac rhythm, but you can actually have it external to you to be able to monitor the heart and circulation overall. And then the final area under disease management that I'm spending some time on is hormones, because hormonal disorders, particularly the thyroid gland, again, Max, horrible things happen, right? Because if you don't manage hypothyroidism but particularly in the female gender, but this is gender independent, you typically land up with an autoimmune disease of some kind. And again, that's a big spend area. That's not an area that's been scientifically cracked yet. I haven't seen that many businesses. But let's just say a long-winded way of saying disease management, big area. I intend to continue to investigate and hopefully invest behind it. And then there's a couple of other areas on the page worth mention. Telehealth and remote monitoring I already talked about. I don't have to say very much about telehealth here. It's you have Babylon down the street. You were among the earliest, I think, to talk to Ali on an HPI stage a few years ago. Fascinating progress, I think, at Babylon. Earlier in the year, El Capitan invested in a company called 98.6. It's a telehealth business in the US. We like that business because it's one of the few that actually has doctors and panels that are accredited across all 50 states, which is very difficult otherwise in the US. So unlike some of the other players in the US, this is an area we like quite a lot. Telehealth is now exploding in Asia, as you would imagine. There's a lot of capital chasing it, but pretty simple business, right? There's not a lot of clinical difficulty there. Remote monitoring is an area I'm quite excited about. It plays to the disease management area, but I think in general, both from big tech, take the Apples, Amazons, Googles of the world, which are going to use any and all forms of data streams to be able to try and figure out what's going on with you, right? Whether it's a camera, you have security camera in your house, or it's Alexa picking up the intonations in your voice, or it's actually a device you're wearing on your wrist. You're basically spewing out data. And the data is over time going to become more and more usable for health reasons. So I expect a lot of stuff in remote monitoring from big tech, but there's also a lot of remote monitoring happening at the specialized healthcare company level. And that's again an area I'm very, 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 very interested in. Dexcom, I think Dexcom and Zetsen are excellent examples of this. Zetsen is actually a small company down the street from where you are, Max. It's in the UK, which is actually talking about a sensor which allows you to actually be able to pick up blood glucose reads without penetrating the skin, right? So quite important technological improvements happening there. And then, of course, this e-pharmacy, which I mentioned earlier, which is really an e-commerce business. So busy page, a lot going on, $300 billion opportunity. I'm quite excited about putting some capital to work here.
Yes, and this, of course, I think you've got one more slide, haven't you, which looks at how global this sector is. Shall we show that briefly?
Yeah. So even on this earlier page, I talked about global and APAC, and this isn't even the most recent page, but this, in fact, is what's quite interesting about this, because health tech was really a technological thing which came out of the US for the most part. And you had some of it in Europe and very little in Asia until China woke up. Right? And I'd say today, just like in the e-commerce side, I'd say digital health is far more advanced in China than it is in any other part of the world. So there's a little bit of leapfrogging that's happened there. As you know, China doesn't have a particularly good primary care system. So when you get sick, you go to a hospital. And which is why the big local technology players, whether it's Ping An or it's Ping An Good Doctor, it's We Doctor from the Tencent guys, and it's every one of the JD.com has its own health, and so is Ali Health. So all of big tech in China have grown its own healthcare businesses, and there's also a lot of specialization, and all of it is happening in the kind of greater Bay Area, particularly in Shenzhen. And then, of course, it's spread. There's a lot of it going on in Israel, quite a lot in Europe, quite a lot in India. So the digital health opportunity isn't a market-specific one. It truly is global. And it also traverses multi-tier across borders. You have many more multinationals in this business that are getting built relative to typical physical health services, which are much more local in nature.
So do you think we're going to see the development of, I mean, if you're looking at disease management, or, one would have thought that one would see the development of large platforms which quite rapidly are going to add extra conditions and then monopolize the market, because many people will have several conditions. So there's always going to be a strength in having a few very large platforms, isn't there, rather than a huge diversity. So yeah, I would think that you're going to end up pretty rapidly within several years with with this market dominated by a few large platforms. But you disagree?
Well, no, I don't disagree. I agree with you, but I think there's just going to be a lot going on here, right? Because the pace at which you're seeing innovation and new entrants at the bottom, I think currently outpaces the pace of consolidation. At some point that'll flip.
Yeah.
Yeah? But today what we're seeing is there is consolidation at the top. But if you were to take a series of snapshots of whether it's by customer, by consolidation by number of patients or number of customers, or consolidation by revenue, you'll probably see that the overall picture looks like it's getting more fragmented rather than more consolidated right now, even though the larger players at the top are actually growing quicker. So will there be let's just put it like this, will there be a healthcare super app, which will be a be all end all on your phone, under which you have 10 disease states all being managed in an integrated fashion?
Yes.
Call it a digital hospital, right, on your phone, which is multi-specialty in nature. I think the answer is yes. I think you'll have some of that. But you'll also have big tech in and of itself, which will do some of this. And then I still think there will be room for single specialty players on the digital side growing for quite a while. So I'm not that worried about consolidation yet. I can't think of anyone other than big tech players in China and the US, which have already begun to consolidate, other than folks like Teladoc. And that's still very,
Yes.
very early days, Max.
So when you look at healthcare service businesses, I mean, to what extent do they, I mean, if you're a specialist outpatient business in fertility, yeah, you're going to be deploying all of this digital stuff as well, aren't you? So the kind of businesses, I guess, that you're really interested in investing in are those which actually integrate digital with really smart healthcare services. Is that
Absolutely.
right?
Yeah, I mean, think about the firm I'm in right now, where healthcare is an important but a relatively small part of what we do. Right? El Capitan
Yes.
is a large global consumer investor, and in fact, parts of the world we're known as a retail investor, and it's retail of all kinds of other stuff. Right? Health is also, in a sense, a retail business, the distributor kind. But we bought fashion businesses and restaurants, etc., etc. Every one of these verticals is facing exactly the same question and same challenge, which is if you don't have digital embedded as part of your service proposition, and where you don't offer the customer a range of different ways to interact with your company, whether it's through a pure digital channel or some kind of omni-channel route or a physical channel route, over time you're not going to exist. So even when I think about single specialty specialist clinic chains or diagnostic chains, if they don't have digital embedded in them as a way of offering a range of outcomes, and also as a back end, over time you are going to find yourself disrupted or attacked by a new player. So it's become a precursor to the right to exist.
Right. Yes. And do you see a very big difference in terms of digital uptake when you look at healthcare service businesses? You can look at several different healthcare services and realize that the management in one company has got it, and that management in maybe some of the larger, more traditional hospital groups haven't got it. Or is that
that is unfortunately
big...
almost always true, Max. The incumbents almost never get it quickly enough. I don't know why it is, but large companies struggle with decision making of this kind. I think honestly, the incumbents in the healthcare side have gotten away with it for very long. And the reason is because healthcare is complex, it's risky, and so disrupting it is much less easy than it is disrupting what Mr. Bezos started with disrupting a bookstore chain. The
Yes.
risks are high. So if you're a young entrepreneur in your late 20s or early 30s and saying, I'm going to improve cancer care, and I'm going to go to a venture capitalist, raise $100 million and disrupt an oncology chain, you better know what you're doing, right? Because people can die. And I think that creates a barrier to entry that's quite high. And it also means that there's just much more failure cases from young entrepreneurs attacking the space. But they're getting better because people are learning this space. There are more and more serious entrepreneurs who are attacking it. So there's much less frivolous attempts being made to disrupt the sector, despite all of the capital that's going into it. So the
Yes.
quality of health tech startups I'm seeing today relative to 5 years ago are night and day, significantly better.
Really? much different, much more aware of the need to integrate services really into what they're doing essentially.
And to make sure that they manage risk well.
Yeah. So I mean, I suppose the final area, I guess, is the consumer. The idea of the consumer buying a subscription service and going into wellness with digital, which I guess would be the sort of sweet spot for you at El Caterton, wouldn't it? Really, you know, the idea of people actually buying stuff and paying the subscription and getting stuff would be nice for you guys. But I think you were saying to me in an earlier call, you'd never really come across anyone who'd done that successfully.
Well, you know, if you go back to we don't have to go back to the slide, but if you just go back to where my firm is at, which is we start with the consumer first, right? We were involved in the build out and over a period of quite heavily involved in the build out of a business called Peloton. Those of you who know the fitness industry will know Peloton as a digitally native fitness company. We have, internet-enabled exercise equipment and a whole bunch of services designed entirely digitally friendly and delivered entirely digitally. So you have fitness programs, health advice, food advice, as well as all of the cohort-based stuff that Omada Health today and Livongo are doing for diabetes. All of that done for the fitness industry. And that's an entirely subscription model. And you can't, Max, you wouldn't believe how well that business is done through COVID. Right? It got listed earlier this year. It's done phenomenally well on the public markets, but not just that. Even just usage rates are up quite a lot. So long story short, people are taking health and wellness seriously. They are willing to subscribe for it. And if they're able to do this on the fitness side, it's only a matter of time before this drifts from that end of the spectrum, the consumer end of the spectrum, more and more to the clinical side. So subscription-based services are here to stay.
Are here to stay. Okay, Chinta. Well, thank you very much for your time and your thoughts and the content, which was fantastic as ever. And I hope very much to meet you in London in 2021. We're looking at the end of June, so I hope we can meet there in person. Okay. Thanks
Max,
very much.
Thank you for having me. Stay safe, and the vaccine is around the corner. Yeah, so be well now.
Yes.
Take care.
Let's get the vaccine. Okay. Thanks very much. Bye.
So here we are at the end of day 3 of HBI 2020. I want to thank everyone who took the leap with us and participated in this event, whether as a speaker, a sponsor, a delegate, and to all the technical crew that have made this possible. You have all shown us that we can indeed find new ways of working, and despite the obstacles, we can still come together and share and learn from each other, which ultimately is what this is all about. I'd also like to thank Sharon here for stepping in at the last minute and doing such a great job. Thank you, Sharon.
Pleasure. Thank you so much for having me, and congrats to you and to all the team, actually, for running a great show virtually. It's been with its challenges, obviously, but everyone's done a terrific job. And Merry Christmas to you and to everybody. Thank you.
It's certainly been a memorable 3 days, hasn't it?
It has.
So this has been HBI 2020. Next year, we will see you in London in the summer, June 28th to 30th at Imperial College, London. And London in June can be almost as beautiful as this fantastic Van Gogh picture shows it to be. And we will be able to explore new vistas and new opportunities in a hopefully post-COVID world. Thank you.